Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And you know, one of the issues now that I used to say there were three main issues that we used to talk about from the, there's always, every issue is important, but people always want to talk about heart disease, cancer, and you know, surgical techniques. Now we have a fourth that hits that list all the time. And those are memory disorders, the issues of Alzheimer's, cognitive disease issues, and we have some terrific people here to talk to you about it. So let me introduce to you, first, sitting in front of me, Dr. Palencia-Kerr, who is a Ph.D. neuropsychologist.
Yes.
Welcome.
It's a pleasure to be here, Dr. Lippman.
Thank you. And we have a nurse professional. I do not know what SCRN is, and you're going to tell me in a minute. And you're the coordinator of the Memory Disorder Center, and you're Milena Cedeno-Oblinger. How's that? Pretty good, right?
Yeah.
Good.
Thank you, Dr.
Thank
Lippman.
you. Tell me what SCRN is.
That is a stroke certification for nursing.
Oh.
I previously was working with stroke.
Yes.
And now I'm working in Alzheimer's and
Good.
memory disorder.
Good. Tell us what the Memory Disorder Center is.
So the Memory Disorder Center is one of 15 memory disorder centers in the state that's partially funded by the state of Florida through the Department of Elder Affairs. And we are required to give an accurate diagnosis to the patients that are referred to us. It is a multidisciplinary diagnosis, as Dr. Palencia-Kerr may elaborate on that, but we have neurologists, neuropsychologists, when appropriate, geriatric psychiatrists. We have a full staff with social work, nursing, and it's a collaborative effort to get the patient's diagnosis, but also take care of the caregiver. What we do that is unique and the only program in the state of Florida is our care assistance program. And so at the Memory Disorder Center, not only do you get accurate diagnosis, we have the latest information on Alzheimer's disease, memory disorder, cognitive disorders, but we also take care of the caregiver. So oftentimes the primary care physician in the community doesn't have the time and the resources to also care for the caregiver and equip them with those tools. And so our care assistance program is developed for caregivers to give them those tools to help them with legal assistance issues, behavioral management, medication management, safety issues that may occur. It's offered 5 times a year for the day and 5 times a year at night. Caregivers have to commit to the program. It's consecutive days in a row, around 16 hours total. But they will, in return, get all the tools necessary to be a caregiver. Our goal is at the Memory Disorder Center to decrease the burden on the caregiver, caregiver burnout, reduce elder abuse, and ultimately help them juggle the daily life of their family if they're an adult child, work, and also be a full-time caregiver. You know, the adult child may be taking care of 80% of those necessary needs, like activities of daily living, special communications, around-the-clock supervision. And so we want to be there at the Memory Disorder Center to help them along.
That's really, to me, it's you're preventing what I call blessing services. So just that's the way I feel about it. And I'll let you know in just a little while why I feel that way. Dr. Palencia-Kerr, tell me what you and your participation with the Memory Disorder Center, what do you do and what is your responsibilities?
Sure, Dr. Lippman. I am a neuropsychologist, so frequently people ask me, what is a neuropsychologist? So neuropsychology is based on studying the relationship between brain and human cognition. And that means thinking skills, memory, language, attention, and of course behavior. So clinical neuropsychologists engage in research, in clinical assessment, in cognitive training, and of course in psychotherapy. So at the Memory Disorder Center at Broward Health North, we are blessed to have a multidisciplinary team. So my contribution is in diagnosis and also in support for the caregivers. My area of diagnosis is doing a evaluation, a neuropsychological evaluation, and that entails an interview and testing, neuropsychological testing. And as you know, that testing is based on normalized tests. We have standardized tests, norms that have been developed through research so that we can compare, in a nutshell, that's what we do. We compare the performance of one patient to the norms with, for example, if it's a male, 60-year-old male, we will compare with the norms for healthy population, for males, and the same background. The ethnicity, the education is important, so that we can determine if the patient has a strength or a weakness in her performance. Now, the diagnosis is not only made by the neuropsychologist, it's made by the neurologist, the psychiatrist, and at Broward Health, we're blessed to have this multidisciplinary team. We have psychiatrists, Dr. De La Gandara and Dr. Pedraza. We have wonderful neurologists too, Dr. Wiley and Dr. Ismail, and I am the neuropsychologist.
You know, it's an interesting thing that even though, in quotes, Alzheimer's has been around for a long time, but the cognitive diseases, the issue of dementia, is really something which the general community does not understand relative to. They see changes, you know. Well, I forgot something. Did I put something in the refrigerator? Didn't I put it? Where did I put my watch? Things of that nature, which sound oversimplistic, but they need to be presented to someone who may, you know, it's sort of like a jigsaw puzzle.
Absolutely.
Am I correct?
Absolutely, that's a good way to see it.
And go ahead.
And I think in that regard, it's very important that the audience understands that with age we have what we call incidental forgetfulness, the keys and all that thing, you know, kind of thing. But when the memory problem begins to be more prominent and the spouse begins saying, he or she is asking me the same question over and over again, he is disoriented in very familiar places, that's when we encourage the person to look for professional help. And something that I want to just clarify is that the changes with age are different than the changes that occur with dementia. We all want to age in a healthy way, but dementia is a disease. There is a neuropathological process in dementia. So it's different to just be forgetful because I'm getting old, and it's different to have a memory problem per se, because it's due to dementia.
And again, you know, we as a general society, the viewers who are looking and saying, well, can't you do something? Can't you take a pill? Isn't there something that we could do to cure this or slow down? Again, you see it on, you know, there's a lot of communication now that's coming through what I would call natural news media. That people are finally starting to understand that these neuropathic diseases are mostly diseases where we have very, very limited, and this is not in any way denigrating to the wonderful people who are working diligently to try to figure out a way to reverse, stop, cure these problems. But we're stuck, in essence. Intellectually, we're sort of stuck. And again, I'm not demeaning all the wonderful science and research that's going on, but it must be very difficult for you when people come in and say, well, you know, can't you do something about this? How about that?
So the Neurological Institute at Broward Health North, through the Memory Disorder Center, works with the Florida's Brain Bank. And because it is a problem, there's about 5.3 million Americans with Alzheimer's disease, and they estimate that in 2050 there'll be about 20 million with Alzheimer's disease. It's one of the leading causes of death in America without any, you know, true preventative, you know, treatment where you can cure it. And so the Florida Brain Bank works with us, and any caregiver or patient that comes through the Memory Disorder Center learns about the Florida Brain Bank and its donation of brain tissue, where not only can the family get an accurate diagnosis that it was Alzheimer's disease, but they're also leaving a legacy, because that tissue will now be, through the medical community, be used to look at treatment options, look at prevention, look at causes. And so that is, and we're also doing lots of research, clinical trials through the Memory Disorder Center as well. So we hope to have some answers with the participation of our caregivers and our families through donation. You know, they can leave that legacy through the research and hopefully come to some sort of prevention, treatment, or some breakthrough over time, because Alzheimer's is devastating to everybody, but it's not going to stop. So
yeah, research is a big component, but I think it's important for the audience to understand that there are very different types of dementia. We have neurodegenerative disorders, and Alzheimer's disease is the most common of these dementias. They account about 50 to 70% of the dementia. We also have Pick's disease or frontotemporal dementias, which affect other areas of the brain. We have dementia with Lewy bodies, and this is important because we can do differential diagnosis. And of course, we have the vascular dementias, the multi-infarct dementias that are secondary to strokes or silent strokes sometimes. So if the audience understands that there are different types of dementia, that will help them to really go and ask for professional help. The beauty, again, in the Memory Disorder Center at Broward Health North is that we have this interdisciplinary team. So the medical doctors, the neurologists, will examine to see what is the etiology, what is the cause of the dementia, so that we can determine what is going to be the best treatment. But going back to the question, because that you did before, that's a very, very frequent question. What can we do to stop the cognitive decline, even if I am diagnosed with Alzheimer's disease? And I think it's important to mention that nowadays we diagnose mild cognitive impairment. That is memory loss that is not as severe as Alzheimer's, but is more serious than just aging. And it has to be measurable, so the neuropsychologist will measure the deficit. I don't want to get technical, but it has to be 1 standard deviation or 1.5 standard deviations below the mean. And it has to have no compromise, no alteration of the ability to function in daily activities of the patient. Whereas dementia, we have the cognitive impairment, but also the loss of ability to function on the daily life. So in recent years, with this advent of this new diagnosis of mild cognitive impairment, a lot of research has been done to say, how can we stop that memory decline? And of course, we all have heard about physical exercise. Why? Why is that so important, physical exercise? Because longitudinal studies have shown that people who are physically active have even 40% less risk of developing Alzheimer's. So it's very important. Also, longitudinal studies like the Harvard School of Public Health with a nurse health study, they determined that the nurses who were followed several years, who were very physically active, they did not show dementia. They did not develop Alzheimer's disease. And of course, these are longitudinal studies, and as you know, they are correlational. And we know that correlation is not causation. So to take the matters, to advance these matters, Dr. Fred Gage at Salk Institute did a wonderful study about exercise. He asked the participants to do intense physical exercise for 6 weeks, only 6 weeks. And then he did neuroimaging before and after he did neuroimaging, and he found that new neurons were developing in the dentate gyrus in the hippocampus. And the hippocampus is one structure in the brain that helps us to memorize, to learn. So I think Dr. Gage did a pioneer study, and everybody cites him. So now we know that physical exercise is not just that it's healthy for the body, but it really benefits the brain.
That's terrific, because we were just talking in another show about prevention and integrative medicine, and physical exercise came up as a major part. In other words, it wasn't just a pill, it wasn't just
Right.
what you eat, but it's part of keeping your body in a position and an attitude to heal itself.
Absolutely.
So, may I call you Milena? Okay. Milena, talk to me, because the reason when I said blessings before, for a number of years in the state of Florida, we had a lot of respite centers for the caregivers for, at that time it was Alzheimer's. It was only talked about Alzheimer's. And unfortunately, there's been less than, to be very candid, there's been less than enough support, I believe, for these respite centers to be in existence. I know right here in Broward County, we've lost 2 respite centers.
We've really developed our community resource list in the Aging Network. And we work with the Aging Disability Resource Center very closely. They do some of our funding for our care assistance program. We will pay for respite so that the caregiver can come and have the training and the tools at that program. But respite it's important, and preventing premature nursing home placement is important, and safety is important. And a lot of times, like I said, it's an adult caregiver who has to juggle a family and work. And just the understanding that you need to keep the person with Alzheimer's engaged in the community, keep their cognitive, all the puzzles and stuff, not isolate them, but also understand that we need to adjust now to where they are and not make them adjust to the environment. So there are things that you just don't understand unless you get out there and get the counseling and education and the tools that you need. The daycare centers have now specialized themselves with Alzheimer's disease and cognitive disorders, and where they keep them engaged and they keep them active and they keep them socialized. They group them by abilities so that you don't get those behavior issues that you may get with isolation and boredom. And you also have another pair of eyes who can tell you, this is normal today, this is not so normal, and you can take that back to the doctor, to the neurologist, to the psychiatrist, and they become a part of the team. So respite, daycare centers, the Aging Disability Resource Center, they're all partners with us at Broward Health North through the Memory Disorder Center, so that we can offer those resources to caregivers and families.
Do I assume that, to me, she's a great heroine, Edith Lutterberg.
Yes.
God bless her. She won't give up. She keeps on going. And of course, so much of the funding that has gone to what used to be the Area Agency for Aging has somehow dissipated. But you should be very proud that Broward Health is willing to take on this responsibility. I bet you receive a lot of people who live in South Palm Beach County.
Right. Yes, Palm Beach County, and in different areas. There's some other memory disorder centers in the area, but we have a huge catchment area at Broward Health North, and people will seek us, even outside of their memory disorder location, because of the care assistance that we offer, because it is so unique. And I think that that's just something that if you have a person with Alzheimer's, not only is it important to have an accurate diagnosis, but to also receive that support. So we're seeing them come from all over to us to receive that assistance, just to have the counseling available, to learn more about the brain bank and some of the clinical trials that we're conducting at the center. So we're open to all. We don't refuse anyone.
Just to let you both know, and you might not know, or you might know, this Nova Southeastern University has invested well over $100 million in building a collaborative research building. And within that center is an element that is doing a lot of research on tissue. brain bank tissue as well. Dr. Palencia-Kerr, it must be a daunting thing, really, to have to, you have all of these metrics. There they are. But these metrics, whether they come from a single individual or whether they come from a paradigm of someone else's research and you're moving one thought to another, it's daunting, because what you have to do is you have to speak to not only the caregivers, but you have to try to communicate with the individual who's reaching out to you.
Absolutely, absolutely. So it is challenging. It is not an easy task, but we do our best to try to identify what are the weaknesses and the strengths of each patient. So that way we can contribute to the diagnosis, and also we can do individualized recommendations, interventions, because we want to ameliorate, if at all possible, the cognitive deficits. And I have to just add that something that I am very happy working at Broward Health North at the Memory Disorder Centers is that we're very aware the Alzheimer's disease is the 6th cause of death in the country, and we follow federal guidelines as well. As you know, the National Alzheimer's Project Act was passed into law in 2011. That was a big issue for us working with dementia. And then they wanted to create a blueprint, and they published the blueprint in 2012. So now we have the National Plan for Alzheimer's Disease that entails clinical diagnosis, research, and services. And those are the 3 components that the Memory Disorder Center has. We have a strong component in diagnosis, a strong component in research, and we have a wonderful team of social workers and nurses that are going to work in the caregiver, to support the caregiver. The burden for the caregiver is enormous and incalculable cost-wise. So the caregivers need all the support that we can get for them. So I think we are in the state of the art. And with that spirit in mind, we use, for example, the gold standard to diagnose and stage dementia, the clinical dementia rating. We recently adopted that measure because it's one of the gold standards that federal guidelines point. So I'm very happy working at the MDC because we are very aware that Alzheimer's is a public health issue.
Oh, it's definitely a public health issue, and then the reason why I wanted you here today is because, like I said, it's now we used to have top 3, now we have a top 4, and the 4th is Alzheimer's and memory disorders. So don't forget, we have a community in South Florida where we have the highest percentage of people over the age of 70. We have the highest number of people over the age of 85 in the United States. So what it is these people want to have some ability to be able to live their lives in some normalcy and in what they feel is an earned value that they work so hard to get to. So we all feel like that, but it's people like yourselves that are giving back to the community, really, which is giving back to our viewers and the other individuals that I said before, it's a blessing, and it certainly is a blessing to have the Memory Disorder Center at Broward Health North. I'm going to give you the last minute, Milena. So,
sure. I think maintaining a quality of life for our elder population is so important, and I'm the next generation, and I am living out the legacy that Dr. Todd and Shelley have started in just continuing building the aging network and being an advocate for it and how important it is. And so I urge all of my generation to get involved. All the legislation is starting to begin soon, and it is the job of the Memory Disorder Center at Broward Health North also to continue educating our legislators and being advocates for Alzheimer's, dementia, memory disorders, and just to help maintain that quality of life, which is so much deserved.
Well, I'm glad you brought that up. We don't usually get into the politics of these things, but you could get the one loud voice that Dr. Palencia-Kerr talked to in 2011 was the prior First Lady, Nancy Reagan. She was a very, very loud voice in Washington, and Yes, she was there as an advocate because of the effects on President Reagan. Right. So I've got to say that the folks that are out there that are interested in the issue of memory disorder, Alzheimer's, and cognitive disease, you've got to talk up. You've got to talk up. Mm-hmm. It's not a matter of sending something in the mail, sending $5, $20, or $100. It's a matter of communicating with the people who help you do your work. They're not helping anyone else except you, the professionals, to do your work. Mm-hmm. So I want to thank both of you for being here today, and I want to remand the attention of the people. And we'll put up a telephone number, the Memory Disorder Center. You'll give it to us, but it's at the Broward Health North, which is right on I-95 and Sample Road. And we want to thank you folks for giving us the opportunity to present some information on an issue that you've asked about. Remember, I always tell you to take good care of yourself, and part of taking good care of yourself is maybe, in spite of the fact that you might not believe that you want to have someone look at you, diagnose you, or otherwise, you have to do it. Help yourself, help your loved ones, and let these...
We'll help you through it.
Right, help these nice people help you through it.
Yeah.
So thank you again for showing up and allowing us to go into your homes this week. Remember, we are called Dateline Health. We come to you from Nova Southeastern University. There's a telephone number right here with an email address. If you have any questions, feel free to send them our way. We'll try to get you answers. Well, thank you once again for showing up. My name is Fred Lippman. We come to you from Nova Southeastern University. Until next time, see you.